We made the decision early on to go with a really robust robotics presence in this building. So to bridge technology with high quality therapy, really excellent physiatry presence. Because of the flow through our continuum, there's much better communication with physicians, with nursing staffs, with the entire team. So it is a nice, smooth transition from acute to inpatient and then ultimately to our outpatient service once they leave the facility.
The InMotion ARM has a pretty unique fit into the continuum of care from inpatient to outpatient care here. If they are someone who has had some sort of neurological injury or condition, such as like stroke or brain injury or Parkinson's disease, then they can get started with the InMotion ARM treatment. And then when I see them for outpatient, we have a baseline and can pick up where they've left off.
The InMotion devices work really nicely with our patients, incorporating that into the traditional occupational therapy that we do. But we've had some patients that have been out from their acute stroke for 6 to 9 months, and we bring them back in on the outpatient setting, and we see that they start to show some really nice improvements, which traditionally we wouldn't predict that far out after a stroke. By introducing them to the technology, when they come back for outpatient therapy, we can be more aggressive with the use of the device to really try to fine-tune the ability to move the paralyzed limb.
The reporting and the graphical data that we're able to get from the InMotion is a way that we can track in terms of numbers how much a patient is improving in the movement of their arm. We can see that visually, but the data backs that up. And so in terms of our documentation, we're able to put specific numbers in there to show an increase in that movement.
And again, this technology it's magical in the sense that it's a way to deliver more reps. As opposed to having a physical or occupational therapist move an arm or leg, the device can incorporate that, and the physical therapist can really focus on the quality of the movement while the machine, the robot, delivers the quantity of movement.
To truly be in a robotic space, you can't just make a few purchases and say you're doing robotics. You have to be looking to move things forward continuously. So we look for relationships with developers, with people that are producing technology. We want to be on that cutting edge and make sure that we are one of the leaders in the country.